Stress has long been a chronic problem for Americans, and a recent poll by the American Psychological Association found that half of us say we wish we had someone that could help us manage it. Dr. Christina Captain is the lead practitioner of the Sarasota Center for Acupuncture and Nutrition, and since April is Stress Awareness Month, she is here to provide some help. Great to see you.
Great to see you.
Do you think people are more stressed than ever?
I would say yes.
It sort of seems like it, doesn't it?
Absolutely.
And is that just a product of our lifestyle and our pace?
I think it's a product of the lifestyle and the pace, but also the current state of the world, the whole world, not just America. Everything is very stressful, and we're so engaged with TV and internet, and we're bombarded with information continuously. So that raises stress level because we know so much more than we used to, and we also don't know if it's true or not.
Right. So there's kind of the psychological thing, but also physical things cause stress. Tell us a little bit about how you manage chronic pain, but yet that also means you have to manage stress.
It's interesting, right? So you can have stress and it can cause pain, like migraines and headaches and things like that. You can have stress that causes insomnia, or you can have long-term pain, chronic pain. Any pain that lasts longer than 3 months would be deemed or defined as chronic.
Okay.
And when it's chronic, you've probably tried a lot of other treatments and maybe unsuccessfully. Maybe you're on medication and that's somewhat successful, but you don't want to be on medication. And so all these things, constantly thinking about, I'm on this drug, shouldn't be on this drug, I have pain, and you're stressed out about it. So they're definitely intertwined. And somebody who has long-term pain, 10 years, like post-herpetic neuralgia, which is from shingles, you know, that pain that stays around forever, or trigeminal neuralgia, or even arthritic neck, back, wrists, hands, you know, all these things that just, you get up and you're like, oh my God, I just can't, I'm in so much pain.
Right. Obviously that's stressful. It sounds awful.
Yeah.
So what can you do to kind of help treat both intermingled?
Yeah, well, acupuncture, of course, treats pain very well. That is very well chronicled in research. We see that all over the place. It's just wonderful for pain, especially pain that is chronic in nature. You know, acute pain, things that happen, you go, you twist, you're playing pickleball, you wrench your shoulder, you're playing pickleball, you roll your ankle, you're gonna fix that. You run, you step in a hole, you fix that. It's acute, it's there for a few weeks, it heals, you go back, you're strong, you go back to playing and running. But with chronic pain, sometimes you don't even know what caused it. And so there's this sense of hopelessness. And when you come to our center, the Sarasota Center for Acupuncture and Nutrition, we love you. We want you to come in. We want to help you. We want you to know that there's hope for people who have chronic pain like that. We can do acupuncture. We have nutrition. We can run laboratory tests. We can help you integrate with your medical team. We're not a us and them kind of practice. You know, it's all about let's get on the team. We're complementary to whatever you're already doing. And if nothing's working, we'll take it head on for you.
And then what about the psychological aspect of that, which I assume sort of automatically improves once you feel like the physical is being dealt with?
Yeah, so stress and anxiety and that comes with that, and just that feeling of depression and hopelessness. Acupuncture is wonderful too, just to raise that, we call it energy or chi, right? We know that it works on brain chemicals, so we know that the neurotransmitters in the brain, those chemicals that make us feel happy, acupuncture elicits that. So when you have an acupuncture session, it's not just about jamming needles in the place where the pain is. It's really about knowing the system of medicine so that you can understand which points are going to make you actually feel better, have a sense of hope when you leave, a sense of wellness, like it's going to be okay. That's the way we want you to leave our office. I feel like it's just going to be okay.
And it definitely is soothing in itself. I mean, even in the small amount of acupuncture that I did with you in regards to a sleep issue, there was an overall kind of calmness that it brought out. And that's hard to do with me. So, I mean, I absolutely will speak to that. So even though it was being done for one reason, kind of the side effect was just an overwhelming which is hard to find.
Yes, and that's the whole point of Chinese medicine, let's say, or Asian medicine. We're looking at the whole body, and the points, they have a prescription. It's not just put the needles where it hurts and do trigger point work like they're doing a physical therapy, calling it dry needling. They're saying I'm doing trigger points. That's not acupuncture. Acupuncture is making a prescription for a patient that you look at as a whole and having it hit every aspect of that person.
A treatment of the whole being, something we could certainly use and that is good for everybody's stress and pain management. For more information about natural medicine and how it can help you, you can find Dr. Captain and her team by going to scansrq.com.